Next, we have our newly elected and energetic MPP, Dave Smith, for our MPP for Peterborough-Kawartha. Thank you for coming, and please join us at the podium. Welcome.
Thank you. We are here for this health conference today, and when we look back at what's happened over the last 130 years, the Peterborough Public Health and its previous incarnations has done a lot of great things. But as I was sitting in my seat, I was looking at the different news articles, and a couple of them jumped out at me. In 1937, the board was considering a bedbug problem. We still have a bedbug problem at different times in our community. Another one of them was that 1 in 5, this was from 1947, September of 1947, 1 in 5 people in this area were living in poverty. And we saw from the presentation that Dr. Salvatore did, we're still roughly at that level. It's about 29% right now of people who have food insecurity. So we've been doing things, the province has been doing things to try and help, but what we have been doing hasn't been overly effective. And it's great to see that Peterborough Public Health is doing this event today on the 130th anniversary. And you're trying to find new ways to make those changes, to look after the people from this community. And I commend you for it, because when we look at what has happened over the last 130 years, we've had some great ideas, we've had some great approaches, but we're no further ahead today than we were 70 years ago. And that's no fault of anyone in the room or anyone who came beforehand. They all had great ideas and they tried very hard to make a difference. And the reason I'm suggesting this, or the reason I'm talking about this, is you recognize that what has been done in the past has been good ideas, but we still have work to do. And you're here today to talk about that work. And you're here today to talk about how you're going to move forward in a different direction so that nobody gets left behind, so that everyone can experience the wealth, the health, and the well-being that most Ontarians enjoy. If 29% live in food insecurity, that means that almost 70% don't. If 70% don't, why can't we move that to 75%? Why can't we move that to 80%, 90, 95? And I commend you on what you're doing today, because you're taking that initiative. You're trying to make the community better. And you're doing it because you recognize that a healthy community, a better community, serves everyone. It's not for personal gain. It's not because you expect that you're going to get plaques put up for you. I've said a number of times to my kids as they were growing up, do the right thing because it's the right thing to do. Don't ask for adulation, don't ask for money. If you can help, if you can make something better, then do it, because that's what we're supposed to be doing. And you're exemplifying that today. Thank you very much.